We defined a vision for the citizens in Jönköping region, where we said that when you live in the region Jönköping, you should have a good life and you should have a chance to live with health as long as possible. Based on that framing, we also started to work with a problem that we had seen the last years, that the waiting rooms in the emergency rooms departments were crowded with people and they had to sit there for many hours. We tried to contact the communities and see if we could collaborate with them. The community said that it was our own fault that we had a lot of people there. So we had to try to walk upstreams and find out how the life was for the elderly people in our region. We found Esther, an old woman, 82 years of age, that lived alone in her apartment. And one morning she called her daughter, and the daughter came home to her and saw that her body was very swollen and she felt very bad. The district nurse came home and advised Esther to go to the care center that was very crowded. And after 2 hours she got the chance to visit her GP. After that visit and a lot of laboratory tests, she had to go to the hospital by ambulance. At 4 in the afternoon she came to the hospital and found a totally crowded emergency room. She had to sit there for some hours, and the young doctor came up to her at 7 in the evening and said, "I don't know what I can do for you. I have to take some laboratory tests." After the test results came back, they found that Esther had to stay at the hospital. Now it was 9 o'clock. We saw then that this old woman that didn't get any food that day had many situations during that day that we could interfere or affect or do differently. So we invited ourselves to the communities again and said, can we collaborate upstreams and reduce the burden for the elderly people by building stronger connections in between each other. At the same time, we started to work very structured and systematic with PDSAs, quality wheels, and we also asked the employees to find indicators that showed how much better they could get if they worked systematically with improvements. This resulted in a belief that if we could at least in 50% of all our improvement works make a better result than we had, we knew that it was risk-free to make the whole system to a learning organization. So we invited all employees to programs where they had to practice PDSA cycles. So the focus is how we can develop value in the meeting between the patient and the provider. Therefore, we today are so engaged in co-production, co-design, co-creation, because we see that if we can work with our work together with the patients, we also design the services based on the need of the patient.